Okay, about to get going here. Well, thank you for coming, and off we go. All right, so my name is Dr. Homa Pierce. I am a chiropractic physician, and I am the inventor of the Lucky and Loyal Dynamic Dog Brace. This webinar is an informational webinar on degenerative myelopathy, how we can help in the early stages of degenerative myelopathy. You're noticing your dog is starting to knuckle. You're noticing that your dog is starting to have difficulty getting up, and this can lead to potty accidents. My job is to talk a little bit about degenerative myelopathy, which is similar to ALS in humans. And what that means is really a demyelinization of the neural sheath around nerves. So when nerves exit your body through the spine, in a dog it's like this, you'll see that these are nerves. There's a little skin that lives on there, and that's what conducts electricity in the body. Well, this starts to degenerate. As you know, we have degeneration in the spine, but we also can have loss of myelination and loss of nerve health in the spine as well. So we're going to talk a little bit about, let me see here. Here we go. So we're going to go over how you can be a good companion to your companion. So caring for a degenerative myelopathy dog takes a lot. Takes a lot out of you. It's a progressive disease, meaning that it will get worse. However, what we can do as a biomechanics expert is I can support you, support your dog. What does that mean? That means I can help you do mobilization with your dog to keep their muscles moving, but also when you work on increasing muscle mass, restoring new neural pathways that may not all be affected by DM, degenerative myelopathy. I'm going to go interchangeably with DM and degenerative myelopathy. What we can do is try to keep your dog mobile independently for longer. So it is a progressive spinal cord disease. It doesn't necessarily cause pain. But what it does is it actually reduces the body's ability to send messages from the brain to the rest of the body. So what is it really? It is a slow loss of nerve signal between the brain and the hind, starts at the end. It commonly affects German Shepherds, Boxers, Corgis, Great Danes, Labradors, other giant or large breeds, and it typically starts after age 8, which feels really young, doesn't it? Yes. So the hallmark signs of DM are knuckling of the back rear paws, excess swaying in the hips, and scuffing of their nails because of the knuckling, and really a slow loss of coordination in the back legs. So part 1, daily care. So early stage mild weakness and knuckling. This is where we can help the most. The first thing to do is to change your environment so that it is less slippery for your dog. So without full coordination in the back end, what can happen is they're going to sploot or flatten out onto the ground more often than not. So if you can get some cheap yoga mats or rugs that have grippiness to them so that they can use whatever strength they have in order to keep themselves up and make the actual living space where they spend most of their time, make it easier to walk on. And this will prevent secondary soft tissue muscle strains or turning of an ankle or something of that nature. So paws and nails. This is really important, is that you trim their paws and nails and keep them super short. You can also use a product called Dr. Busby's toe grips. And Dr. Busby's toe grips are these little plastic sleeves that sit on top of the nails and give it more space or surface area so that the dog can actually grip when it's walking along the transition areas between the floor and the carpet or mat or the yoga mat that you put down. These are also really great for preventing skin abrasions. So they sit on the nail, but they're also on a tiny bit of the toe. And so what that does is as it sits forward of the toe, it protects the toes. So Dr. Busby's toe grips, great recommendation. And if you're interested, I can always put her website in the chat. So weight management. If you can keep your dog lean, it just puts less weight on their joints. Just like in humans, keeping yourself lean on your joints will help your joints last longer. So ask your vet. There's actually a targeted body condition score that they can do, and they have a bunch of metrics that they use, including mensuration, which is a measuring of a limb to see how it compares to the other limb. They'll inspect your dog and give you a score. And that score becomes the baseline from the date that you have the diagnosis of DM. So you have something to compare as the dog ages a bit more down the road. So we want to help our dogs the best way possible. Once your dog advances into hind limb paralysis, my actual product will help lift their legs if they still maintain certain reflexes that, again, your rehab vet will help you with when you get scored, and also scored for a livability score. But transitioning to a wheelchair requires quite a bit of planning. So your dog is going to need help still going upstairs, still help going down some stairs, getting out into the yard. If your yard is uneven, an actual wheelchair may not be appropriate, and you'll have to use some help them up handles and vests that are available to help your dog get up and around. If your dog is recumbent, meaning that it's lying down and can't get up, you're going to have to roll them as if you would roll someone to prevent them from bed sores. The body weight of your dog, if it's overweight, you have to move them so much more often, like every 2 to 4 hours. If your dog's body weight isn't that bad, then it's more on that 4-hour time period to roll them and keep them engaged with you and that moral support, but also to prevent bed sores. Bladder expression. I am not a veterinarian, so I will not be giving you any advice on bladder expression. However, it is necessary in late stage with limb paralysis. Just need you to be aware of that. Now let's talk about middle and early stage care, exercise and physical therapy. What can we do when our dog can still get up and can still walk, but has the sway, but has the knuckling, and has obvious weakness? Well, This is where hydrotherapy or underwater treadmill walking or swimming is gold. Um, it the buoyancy will hold your dog up, and it will exercise the limbs. It's helpful, and it will exercise them in a non-weight bearing environment. But in my personal opinion, I think making sure that you have some weight bearing and coordination work, like with the cavaletti rails, those are just pipes with little cones that dogs have to step over. And you can do this with your dog if you put a pillow down and have them step over it. And then targeted walks. When your dog is walking, you want to watch them and try to help them correct. The best way to do that I've found so far is with the help of a rehab veterinarian. And the rehab veterinarian will give you specific exercises and massage work to keep your dog's weaker side or their non-conforming side, um, maintain as much movement as possible in a quadruped model, meaning in four-legged movement in coordination. The big thing here, though, is, and this is one of the reasons I created this bracing system you see on the German Shepherd, is you can put my vest and sleeve system on, and with the help of a veterinarian, place it correctly, because we're trying to mimic muscles that typically get demyelinated early. And so this is a German Shepherd, and typically with German Shepherds, because they have that that tiny angle in the back, they're biomechanically at a disadvantage. See that? A disadvantage when they, unfortunately, if they contract DM. So we want to mimic hamstrings, and we want to mimic a tensor fascia lata. That is a lateral outside of the leg muscle. Now, let me show you some passive range of motion work that you can do with your dog. So, not necessarily wearing the brace when doing this, but it's actually a great way to keep um, joints that are also affected by arthritis happy and juicy, and have more range of motion over a longer period, instead of letting the dog just get into stiffness and then having to deal with it later. It's good to be proactive. So passive range of motion is really the cornerstone for all physical therapy, chiropractic, or rehab that you're going to do with your dog. As neural pathways start to degrade, um, voluntary muscle control fades, right? We talked about this a little bit. And so joints can become stiff and tendons can shorten, leading to contracture, meaning super tight and stiff. And you might see the dog straighten their leg a lot more when they're seated, or you might see that where the wrist and ankle are in the dogs, those tend to be a bit more stiff. So passive range of motion is when you take the dog's system and you move it for them. Okay? When you move a dog, that is called passive range of motion. When they move, it's active range of motion. And my vest and sleeve system are designed to help with active range of motion. So when the dog is not wearing the sleeve or the vest, is that this is where we can start working the dog with our bodies, passively moving them. Okay. So never force a movement, meaning don't jam their joints to get them to be in full range of motion, or you think that you're going to be able to move them into full range of motion. That is really where veterinary chiropractors or certified animal chiropractors work best. Also, your rehab vet. they'll warm those muscles up around the area. They might use shock wave. That is a sound wave that moves into the joint to help it move better and increase hyaluronic acid production, that juicy joint stuff that lives in between the two bones. You want to support long bones when you're working with dogs, not just the joints and trying to grip it and rip it kind of thing. So with DM, it's not really a pain thing, which is nice because you can really be able to connect with your dog on the other side of what pain can stop you with that connection. So you can feel their joints and you can help them move, and you're going to look at their face when you're moving joints around in a long bone manner. Watch their facial expression. Take a look and see if they wince or see if they turn away from you. Read the cues that only you know your dog best, and you'll be able to feel, maybe even if you're a little bit more proficient at it, you'll be able to feel them tense up, and that's when you know you don't need to go any further. Right? And also your veterinary rehab professional will be more than adept to help you with this when you go and visit them at your puppy's next appointment. Now, when you're working with the dog and they're lying down, you want to keep their spine neutral as possible. So horizontal to the ground, because if they're all twisted up and you're going to try to move them, it's not going to feel good on the dog. And you want to move through everything comfortably. So this is what I would call just a couple of super simple daily range of motion exercises that you're going to do passively with your dog. So you're going to run this routine 2 to 3 times daily, depending on the level of stiffness and depending on that score that you got from your veterinary rehab professional. And you're going to aim for about 10 to 15 reps of each movement per each leg, including the legs that seem to be okay, right? Those legs, unfortunately, later on down the road will be affected by DM as well. But if we are proactive in our care of our dogs and we work on those anterior limbs, front limbs as well, you're going to be able to save these joints and have your dog feel better as they progress from my type of bracing into a wheelchair, because the back legs will be suspended. They can still wear the resistance and recoil sleeve in a wheelchair, which is nice because once they are still able to activate, then they activate, meaning move a little bit. My bracing system, the sleeve, will help that action occur even in later stage paralysis. Many practitioners do a reflex where they pull the leg back and watch for the return. As long as your dog still has that, my sleeve system will still work for them inside of an actual wheelchair. I know that sounds crazy, but that's how it works. So how you would do this is you would have your dog lying comfortably on their side on a thick padded surface, and you sit behind their back like I am and face the legs. Then you just gently grasp their paw and you flex the toes upward, and then you flex them down, curl them down. This prevents that crackly kind of feeling that I know some of us feel in our spines and our joints too. But you want that gentle motion. And don't overdo it. Don't push it all the way up like that. Just a gentle range of motion like that. And then you want to do it at the hock, which is that part of the heel, the long heel of the dog's leg, and you want to just gently hold it like in the picture, and then just move it gently forward with the knee, and then using one hand to stabilize, you can absolutely help your dog with that range of motion as well. Part 2. So stifler knee, you can place a hand on top and then another hand holding the knee, and then moving the entire leg, and then flexing and extending the knee, that will be helpful. And then also at the hip. And then you want to do a bicycle motion. That bicycle motion will mostly be coming from the hip, but it will absolutely help the knee maintain its range of motion. And these exercises you can practice at home. You can videotape them or tape them with your phone, and then contact your rehab vet and send them the video showing in this angle, the way that this picture shows, what you were doing with their joints. And they would be able to telemedicine help you with increasing some range of motion or decreasing some range of motion if necessary. Now, all of the notes that are shown in this presentation are available for you guys. You just email and I'll be more than happy to send you a copy. The email will be admin, ADMIN, at luckyandloyal.com. So, tracking progress, that's important. So, regular assessments that you do help your veterinarian, your rehab veterinarian, start to manage the DM well. So they're going to ask for proprioception knuckling test. And here's how you do it. And that is while your dog is standing, you're going to gently flip one paw backwards. So the paw rests on the ground, but it's back. And then what you do is you see if the dog instantly corrects itself, right? And you can time that. The second one is to watch to see when your dog is walking away from you in a straight line. If they sway, try to gauge how much they're swaying. And then also whether or not they actually cross their back legs, one leg or the other. Now, my system can certainly help with that because it acts like a second layer of muscle. We can stretch one side to keep it up if one side is crossing and the other one isn't, or we can center it if both legs seem to be weak at the same time. This we can do through a Zoom call with our veterinarian, our house veterinarian, or myself, the inventor of this system. And that is always complimentary when you've purchased a bracing system. Also, you want to watch your dog sit to stand. If it takes longer as time marches on, you're going to want to get some sort of physical therapy amped up a little bit for them. So the hydrotherapy is a great way to go, or you could purchase this bracing system, which you just basically set it and forget it. But you do need to take the sleeves off at night. So this is how you would track things, right? You would have the date, the knuckle response that I just taught you, scissoring, yes or no, or by how much, right leg or left, sit to stand tries. Does it take your dog more than one try to get up? Does it take it 2 times, 3 times? And then you can also put a time in. It took him 30 seconds to get off the ground, and then 3 weeks later, it took him 40 seconds to get off the ground. These are the kind of incredibly intuitive notes you need to take when caring for your dog with DM. So, postural muscle support. These are the deep muscles in the spine, the muscles that are the postural muscles that help a dog get up and maintain its posture. So some dogs can have that sway in the back because they're heavy in the belly. That's going to pull on the backside of a DM dog and possibly accelerate the rate of degeneration. We don't want that. We want to bring that belly up. And how can you do that? Well, my vest and sleeve system happens to have a wonderful elastic mesh portion to it that helps hold bellies, which takes pressure off the spine and sets a dog up, biomechanically speaking, for better ambulation. So our actual system was built in veterinary integrative medicine, meaning I took all my prototypes 386 of them, to different chiropractic veterinary practitioners, veterinary acupuncturists, and a well respected since 1969 rehab veterinarian here in Portland, Oregon. And what we have done with DM dogs is we've kept them walking, period. That's the best that we as a functional bracing system can help with. We add a second layer of muscle when the original layer of muscle starts to degenerate. So we've had a really great success rate. Unfortunately, with DM, like ALS, the prognosis is usually just a year. And with the DM dogs that I've braced, and truly, they've been mostly Great Danes, boxers, and German Shepherds. These dogs have lived 2.5 to 3 years longer, still mobile, wearing this bracing system. And so we help you fit the brace by a pre-Zoom, meaning before you buy, you and me and your dog. We have a little measuring session. I watch them walk, and I go through all of those things in this seminar that I just told you about. And we help you determine if this system is going to be the right thing at the right time. Also, if it isn't the right thing at the right time, we will tell you that too and help you get through to the next step. Might be a wheelchair system. It might be certain types of new medications on the market. It might be a co-treatment with your rehab vet. I just did a co-treatment video with a veterinary nurse and a DM dog who was wearing my system inside of a wheelchair. It's on YouTube. LuckyandLoyalCom.com is the address for the YouTube page that has a whole bunch of videos, hundreds of videos of dogs wearing the system, living in the system, and thriving in the system. And in case you didn't know, I actually made this for my own dog. I made it for Cooper. Cooper is a Vishpu. He's a little white dog that's in all over my website. That little guy was my heart. And he actually had IVDD, which is totally different than DM. However, I built this system for him. And he was 13, and I was given the options of a $14,000 exploratory surgery, cortisone shots every 3 to 6 months, or I could put him down. And I wasn't going to do that last one. I'll be honest. I was totally selfish. I loved him, and he loved me, and he wasn't ready to go yet. And you know that. When you look in the eyes of your DM dog, you'll know that. And so if your dog is still like my Cooper was, raring to go, wants to go, trying very desperately to get up, but is getting up, but it's hard, then this is for you. It's I'm here at every step of the way. So you can do the Zoom before, we will do the sizing with you, help you measure, and then we'll do a Zoom as soon as you get it. You book the Zoom with our veterinarian, and she will help you place the sleeve in the spots where it mimics the muscles that are the weakest. And that's really all it is it's a vest and sleeve system to help you understand more or less how to help your dog keep moving. All right. Well, I hope that this was useful, and I hope that it helps you move forward with the love of your life, as I got 7 extra years with my Cooper. If you have any questions, you can certainly pop them in the chat, and I'll be more than happy to help you with that. Oh, I see I have a question from Janet. Hi, Janet. Where are you from? Toronto. Right on. I actually went to school in Toronto. Yeah, I went to school at the University of Toronto, where I got my degree in vertebrae evolution. And so it's kind of funny. I'm actually using my degree. And so it's part of how I ended up developing this product. So what was your question? How can you wash the Lucky and Loyal? Yes. Okay. So it is completely machine washable. Yes. You can throw it in permanent press, have it washed, throw it in the dryer, and it will dry. It's I built it that way because I am a dog mom and a mom. And so it's a two-piece so that we can actually move the sleeve wherever you need it. And also in the future, if your dog does recover or require more tension in the sleeves, you can try this. You can toss the sleeves into hot water in the hot wash in your machine and dry it on high, and it will come back to its original shape. This product is made for real life with real life dogs. So you can put a knuckling boot on the leg of your dog and have the sleeve sitting up near the knee. There's two types of sleeves. There's a standard sleeve which attaches below the knee, not recommended for squatty dogs because it will pull them down. So I invented a sleeve that sits over the knee and just lays flat this way, lays super flat. And this one sits above the knee. And that way, the dogs with the big angles, they don't necessarily collapse the same way. All right, any more questions? DM. DM is a progressive disease, yes. And I want to know if I put this on my dog, will it keep him walking longer? Yes. It also depends upon how long your dog has had the diagnosis. If your dog has had the diagnosis more than 6 months, but can still get up and go, I think it's worth it, because we've had a couple of these dogs. If you've been to my website, right on the homepage, scroll down a little bit, there's a video of a dog. Her name is Pearl. Pearl was a white German Shepherd, and she had DM, and she loved her huge Hollywood Hills backyard. And as she was going down those stairs, her legs give out and she just falls down the stairs. In a week, we put my bracing system on her, and she's actually wearing the Squatty Dog Severe sleeve, and she navigated those stairs like it was no tomorrow, no problem. She lived an extra 2.5 years from that diagnosis. So I'm pretty proud of that. And so she's on my website and also on my YouTube page, so you can watch how what level of degeneration she was at and how she recouped herself and was able to resume her activities of daily living. So I hope that answers your question there, Dave. All right. Any more questions? No? All right. No worries. If you ever have any questions, you can always email me at admin, ADMIN, at luckyandloyal.com, and I will be more than happy to help you in your journey with your DM dog. All right. I hope this was helpful, and I hope to help you in the future. All righty. Take care. Bye now.